We're going to talk about right now what it means to remove a mole, M-O-L-E. I think that's basically a layman's terminology or colloquial expression for what a medical personnel would call a nevus, N-E-V-U-S. It's just basically a spot, as you know, on the face that just you don't like and you want that removed. A few important things. First of all, it's important when I'm evaluating a mole to make sure it's not cancerous. Now, I'm not a dermatologist. I usually, if I have any suspicion, will send you to a dermatologist to do a further evaluation, especially if you have a strong family history, if you have a history of having a significant number of skin cancers, if that particular mole, if we will call it that, has changed in shape, size, if it's bled, or if it's changing color as well, or it starts getting a little bit of an irregular border, all of those things would indicate to me that there could be a chance of it being cancerous. Again, most of the times if we're just talking about something that's been static, it hasn't really changed over a large part of your life and you're born with it, or even if you developed it with some sun exposure, those things can be easily removed. Now, what we're going to talk about today is not really a mole that is flat. We're talking about a mole that's sort of a larger raised lesion. The reason I want to talk about that particular condition is that if you've got a raised mole, it's sort of like the tip of an iceberg. So if you're looking at the side view of a skin, this is the mole here, but there are roots that go all the way down. The problem that I find oftentimes when, for example, maybe a dermatologist or someone, or a family doctor or someone else may be trying to remove this mole, is that it could be burned off or just skived off or shaved off, and that oftentimes leads to a very high recurrence. And simply because, again, if you think of a mole like an iceberg, there's a large component that's under the skin that must be removed to have a successful removal of the mole and to minimize recurrence. Now, I don't treat this like a cancer operation. I don't take a very large amount of skin around the mole, but I do take a little bit of a margin around the mole, about 1 millimeter, 2 millimeters, simply to limit the chance of that mole coming back. Now, let me talk to you about how exactly I remove a mole. What's important about this is to remove the mole, as I said, full depth to remove the entirety of the mole. And I also follow what's called a relaxed skin tension line. What's important to think about this is the whole face is structured so that we have what's called relaxed skin tension lines. That's how, if you close it along these relaxed skin tension lines, you get a better closure. For example, down here if you get a mole, the best way to remove it is not going this way, which would be against the relaxed skin tension lines, but in this direction along the relaxed skin tension lines. So if you're confused about what I'm talking about, I actually take that mole, and instead of just doing a circular removal of the mole, which would purse string and cause a bunching, I do what's called a fusiform removal along relaxed skin tension lines, so that if the mole is here, it will be a little bit beyond the edges of the mole, so that it looks sort of oblong with tapered points. The reason I do that is so that it closes well. So in other words, the length of the incision will be just slightly beyond where your mole is along these planes of relaxed skin tension. Part of what I do also to really allow this to heal well is, number one, I do a 2-layer closure. I do a closure in the deep tissue so that the skin is well approximated and there's no tension on the wound edges. When there's tension on the wound edges, the incision doesn't heal as well. By using a deep buried suture that dissolves over time, that really takes the tension off the skin and it allows your mole to heal so much better. The next thing I do is when I close the skin is I close it with a slight amount of eversion where the edges are actually kissing up a bit. That allows the skin to flatten out over time and allows you to have a much better result. I use non-dissolving sutures for the outside because your healing is much better when I do that compared to something that dissolves. So I much prefer to use non-dissolving sutures that I remove about 7 days after the procedure. It is a very small procedure. It's done either with a little dental block or with a topical anesthetic followed by an injectable, which you really shouldn't feel with my acupressure, acuvibration techniques. You really, in most cases, don't need any sedation. It's done in my office setting, done over a period of about 30 minutes to an hour, depending on the number of moles. One thing that's so important is that when I do remove a mole, over a period of the next few months, that line will still be visible. And that's simply because I've taken a mole out, there's a little bit of maybe some redness or darkening of that area. I do ask you to stay away from a lot of sun exposure. And over a period of a few months to a year, it really begins to fade and fade and fade. I need to see you back frequently after a mole removal simply to make sure this area doesn't become slightly thicker. That would indicate an early scar. I'm very hands-on with my patients. And I always encourage you to come back if you feel like something is not quite as perfect as it could be. And one thing I notice is that if it becomes slightly thicker, I use a little scar dissolver that's non-steroid based that really helps soften that very quickly within a period of about 1 to 2 months as I continue to follow you. Sometimes I also need to come back and do what's called mechanical dermabrasion. This is not to be confused with microdermabrasion. It actually sands down the outer layer of your skin. That's really to smooth down the area so that it becomes less obvious to be seen. And that is another week of recovery. I usually include that in the cost of my mole removal. I do send the moles off for pathologic evaluation. There's a small extra cost for that because I can't just simply remove a mole and discard it. We need to know exactly what it is, and I will tell you about that nominal fee when you come in for consultation. Those are some of the important things to know about moles. Remember, one more thing is that you're trading off a round or elevated brown or whatever color mole for a line, and that line should heal very, very well to the point where it's almost gone. If it needs a little bit of a touch-up work, obviously I'll do that, but that's pretty uncommon. So remember that you'll always have a fine line when after I remove a mole, but because of my techniques, I make that fine line almost unnoticeable to the naked eye unless you're really, really in close range. So those are some of the ideas that you need to know when you're thinking about having your mole removed.